While we're waiting for them, just a quick note. You asked about the language on Article 12, not just the numbers that we've agreed to, which would, or are ready to agree to. And so we will, I don't know whether Paul or Brooke have had a chance this morning to put the language together so we can talk about it today. If not, we'll get it to you shortly, maybe early this afternoon. And so then we can TA it whenever. I think,
Okay.
I think the language itself is non-controversial.
Okay. Sorry, I almost cut you off. Continue, Bill.
And then the specific items where we're making changes that go in the appendix, we can just TA that part and say it will be reflected in the appendix.
Okay. Gotcha. Yeah, and looking at Article 12 now, and I still have the Word document of our original proposal from January, which I can send you all for you to edit. The only changes I made back then were date specific. So anytime it said 2017, 2018, which is just I updated that information. The only other information I would anticipate a change on is 12.1, where the monthly premium is specifically cited.
Yeah.
And I guess we'll talk about this in a little bit, but we've talked about our members, and I'm anticipating that the dependent care escalation clause, we haven't talked about changing it, but what would have to change is the monthly rates provided in the contract are back from 2017 to 2018. I think those have changed now.
Right.
Okay, that sounds good to me. Let me make sure. I'm going to reach out to our healthcare chair one more time to see if she's making it. I know that she finishes her office hours right about now.
There's Brooke. Okay.
Bobby's on.
Yeah, and I think we're still waiting on Paul as well.
Right, Paul and Rachel.
And Victoria and Kay are on. Anna, do we have enough meetings for you?
You know, my plate is full. And it's open enrollment season, so.
Oh, yeah. Yeah, I did my open enrollment stuff.
I'm proud of you.
I guess Monday.
Good for you on the first day.
You got it.
Way to go. I feel like I should have stickers, like when you go and vote early. I feel like I should have stickers for employees who do their open enrollment early.
Boy, the voting numbers are fascinating. The number of people who've already voted.
I went on Monday. I went on the polling location on Main Street, and I was in and out in 15 minutes. I was so pleased.
Oh, that's good to know.
Yeah, I voted on the 29th of September by absentee and just stuck it in the mail, and I've got confirmation that it was received. So.
Hey everyone, I'm sorry I'm late. My office hours ran over.
That's okay. And Dr. Sumfest, you have only half an hour, right?
Oh, actually today I do not, but please don't feel free to take the whole hour.
Yeah, all right.
But I'll be honest with you, I don't have anything. That was last week.
Oh, okay, all right.
You've given us a lot of your time and we appreciate it, Jill. Thank you.
Oh, I'm happy to make sure that we've covered everything. So did you want me to, I put together just a Word document just to go back over one more time the benefits that we landed on.
If you don't mind, since we have a lot of people here today, I think that'd be helpful if that's okay.
Okay, so can I share the screen? Can you give me that, Javier?
Yes, I'm going to work on that now.
Okay. Just say when.
Oh, apparently you were a co-host, so someone has beat me to it.
Okay,
Becky probably did.
very good. Thank you.
Click
Becky.
on the draw.
Okay, so this is just, you've seen this before. This was what we landed on the 9th of October. Limiting the tier 3 hospital coverage to emergency services only. That does include inpatient care associated with an emergency room visit. And that's both in and out of area. Increasing the annual pharmacy deductible by $25. So it is $125 per individual with a maximum $500 for a family of 4. Increasing the ER per visit deductible on tier 2 and 3 from $250 to $350 for in area, and on tier 3 for the out of area plan. Increasing the tier 2 per admission deductible from $1,000 per admission to $1,500 per admission, and that is in the in area plan. Add a 10% member coinsurance at Quest, both in and out of area. That just puts you on the same playing field for if it's done at outpatient hospital, it's a 10% coinsurance. The deductible is waived. Increase the maximum out of pocket from $2,500, $5,000 to $2,700, $5,400. That includes tier 1 in area and tier 1 and 2 for the out of area plan. Increase the copay for urgent care center by $5, so it is $35. That's for tier 1 in area and tier 1 and 2 out of area. Increase county year deductible from $100, $200 to $200, $400 for tier 1 in area and tier 1 and 2 out of area, and then increase the tier 2 in area deductible from $300, $600 to $400, $800. That's only in the in area plan. We added 30 visits for speech therapy for developmental delays, ages 18 months to 5 years at tier 1 UF health providers only. They have since come back and asked us to expand that so that if a child with developmental delay in that age range may not get speech therapy, but gets occupational therapy or PT, they will flex that benefit so that they can use that 30 visits combined for all 3 modalities. So just a little bit different, but it doesn't change the intent, which is developmental delay. Replacing co-insurance with a flat copay for ambulatory surgery centers, advanced imaging, and standard imaging at freestanding centers on tier 2 out of area. We're going to maintain the unlimited Talkspace messaging and video visits at $0 cost share. And beginning sometime the first quarter of next year, we'll have access to psychiatry visits for medical management. So that if someone currently is on something that requires a psychiatry prescription, that can be switched to Talkspace at no cost. So that would be additional savings. And not on this, but something we did agree to is that for the virtual visits to New Direction providers who are capable of continuing virtual visits will be at the specialist copayment, the $20 virtual visit copayment. It'll be available to anyone living in the state of Florida, but many of them may not have licenses. And if you have someone who is residing at home doing remote learning, they may not be able to access that virtual benefit because the provider has to be licensed in the state of Florida. So that is a little caveat we have no control over. And that'll just be on the benefit slip qualifying that information. Adding Weight Watchers online and in center at 50% discount off the monthly subscription fees. And just making sure that suicide is an eligible indication for repatriation coverage. We've talked about that before. Let me find my arrow here. And so on this, what I wanted to go back over is that all of those benefits still required a 2.4% increase. So this walked us through, so 2.4% increase in the total monthly rate. This is what the current rates are by coverage tier. These are the new rates with a 2.4% increase. I wanted to just go back over, and this is based off of the percent paid by UF for the family, for the spouse, children, and family coverage levels. I kept the same percentages as they had been. I don't know how those percentages were first developed in terms of the employee-employer contribution. So I just went off what they were, but calculating the increase of $2 per month takes you from the university paying essentially 96% of the premium to 95% of the premium, but maintaining the same percentage that they pay currently. These are the new rates for those employer coverage. So you can, I just took, you know, these, and they're increased by 2.4% essentially. So that's, again, that was using the same percentage. That, I guess, is a decision that UF makes on what that employee contribution will be for those levels. But since I don't know how they were initially calculated, I just applied the same percentage.
Okay, thank you, Dr. Sumfess. This is the same information that we got, I think, in that October 9th email with the addition of the recalculation of the contributions and percentages. Are you amenable to forwarding that to us? We have.
Absolutely.
Okay, great.
I just took it from different emails and put it in one document so I could easily pull it up to share, but I'm happy to send that to you and to Bill, and you can send. Now, again, that's proposed. I can't put the, you know, it depends what UF wants to do on the family tier coverage and how to do that.
Understood. Yeah, this is much neater than I have that email, but I'd rather work with a Word document and publicizing the information that we'll make concrete today.
Okay.
And we on to, I can't imagine that we, you know, I think we're thrilled to hear that there's an expansion of services when it comes to that that developmental therapy, those 30 visits. That's okay with us, that it's not all speech therapy. And I'm glad to see that the virtual visits through Talkspace will expand to the New Directions providers as well.
Well, it's a little different, Javier.
Okay.
Right
Okay,
now,
can you clarify that for me a little bit?
absolutely. So Talkspace is $0 cost share. Okay. The New Directions, because they are providers and I have no control over their rates, it would be at the $20. It would be as if they were a tier 1 UF Health provider, and they get the $10 PCP and a $20 specialist copay for a virtual visit. So because we have expanded access to those providers, we are now saying, well, any provider, so it actually gives you more than if you had face-to-face visits, because we have tier 1, we've designated those New Directions providers in Jacksonville to be tier 1 and also in Marion County, Ocala. So, so now gives you a broader options to local providers as well, because it's virtual. Now, again, it depends if they continue to do virtual visits. But it is at their same rate. So I can't imagine that they would, if they're currently doing them, that they wouldn't want to continue doing them.
Understood. So it's what I got wrong is that the specialist copay would apply for the employee, whereas it's not being subsidized through Gator Grad Care like Talkspace is being.
Yeah,
Right, so it's a virtual, it is a, right now we are, well, because of the pandemic, we're covering non-UF health providers for virtual visits. But once the emergency order ends, and that is due to end for Florida Blue at the end of the year, you would not currently have access to virtual visits if it's not with the UF health provider or a student health care center provider. So what this does is it says, we're going to say, we can't really do it outside because that it is just a Florida Blue contract. You can, if you're currently seeing them, either in face-to-face or currently being treated or getting a virtual visit, you will, which now you're paying the $30 copay, it'll be a $20 copay. So
Okay.
it is still a savings, but it's not being subsidized like the Talkspace ones. And that'll be reflected on the benefits slip specifically, rather than on this, because that was sort of after the fact.
Okay, understood. Thank you, Dr. Sumfess. I think the only other benefit we discussed, and we wanted to codify it into the MOU instead of the current contract, would be continued coverage for COVID-related costs into 2021.
For inpatient is what we agreed.
Okay.
Okay, and yes, that you certainly, and I've, that's already being coded from Florida Blue's perspective.
Okay, and
So I apologize for not stating that.
that's okay. It's kind of a different animal for our bargaining purposes. I imagine we might summon you again to work that out for the MOU, or you might kind of work behind the scenes on that.
Sure,
Okay.
happy to do that.
Okay. All right. I think that everything kind of looks in order. Bill, if you have any comments, or Paul or Brooke or anyone else on the university team, we'd hear them. Otherwise, I guess I have some updates on our end.
I have nothing else to say at this point.
Okay. So we've had the opportunity, and Rachel, Bobby, any comments on before I kind of share where we're at? Okay. Getting a head shake. So we've had the opportunity to caucus with our membership about the current benefit proposal, and kind of educate as to what terminology means. There's quite a bit of that we need to do on that front. Still, I think we had some initial friction of the same flavor that was present in the last public bargaining session. However, I think that won't stop us from ratification, especially given kind of the air of negotiations so far. So I have permission as chief bargainer to accept the Appendix F proposal as written.
Okay.
So I mentioned this a little bit earlier, Bill, but we also we were anticipating a full Article 12 TA today, so we also went over the remainder of the language in the contract apart from Appendix 12. I'm sorry, Appendix F, and what I have permission to agree to is also just changes in the dates for Article 12. You know, some stuff is 2017 to 2020, 2017 to 2018. The monthly premium,
Right.
which is part of subsection 1. And we had some people inquire about the dependent coverage, and that's something we haven't really fleshed out here. So we're under the impression that the university wants to keep the same escalation rate for that at 5%. We would just need to update those numbers because they're dated back to 2017. I imagine the coverage has increased at least 15%, given some compound interest there.
Do you have that ready to put online? I mean, so we can all take a quick look.
So I can share with you the Word document that I have.
Yeah.
We would have to update that information, and I'm going to send you what I sent you back in January so that you guys can make the modifications
Okay.
Because this is technically your proposal, right? So just for the sake of procedure, I can forward that now to you, Paul and Brooke. Is there anyone else I should copy on that?
Becky,
Okay. Gotcha. Bear with me a second. Sometimes my computer's a little slow and everything else but Zoom when I've got Zoom up. Bobby, Rachel, any final comments while I'm working on that?
I'm good.
Okay.
Yeah, I don't think so either. Again, I do want to echo your thanks for Dr. Sumpfest for being so helpful and patient with us as we all struggle through this not very fun bargaining issue.
no.
Well, I think you all have been very easy to work with and have been very thoughtful in your in this process. So being able to share data with you and you using that data to make an informed decision, I think has been very helpful. And I think it's a good way to approach this.
Yep, I agree.
Agreed.
So from my perspective, Bill, you need language, just say no member cost share for COVID-related inpatient services for calendar year 2021, right? That's pretty much it.
Yep.
Okay. And then you'll give me or share with me the final contract so we can have it for our records.
Right.
The 5% escalation, that was an increased rate. So that if we have to increase rates from one year to another, it doesn't impact the employee only, but it would impact what the if UF decides to pass that along with the
Right.
dependent coverage. Okay.
Yeah, the for those who weren't around last time, or maybe even 2 times ago, the dependent care coverage originally was not even in the contract. We put it in the contract. It's at their expense. And we were concerned that the dependent care numbers were just very, very high. They had jumped like 60% from one year to the next or something like that. And it was just a quirk in the system. And so we wanted to make sure that we provided some protection for the membership on that.
Understood. Thanks, Bill. Okay, so I've
But we want to point out, we did lower the overall dependent rates last time compared to where they were before they were in the contract.
Well, I don't recall.
Yeah, it was cheaper when we signed the contract than it was before.
Oh, it was astronomical before. I don't remember the exact numbers.
Bill and team, I've sent you an email. Should be include a Word document.
Okay, can we get that up on the screen?
Sure. Give me 1 second. So I hope you all can see my screen. I'm going to zoom in a little bit. If it lets me, man, this thing needs to get out of my way.
You could zoom in a lot a bit because I'm having a real hard time seeing that.
Yeah. I didn't know that you could move the top bar on Zoom.
No, you know what? If you go back in, oh, you can move the top bar. I was going to say if you just increase the size of the font, you know, on the document itself.
That's better.
Okay, so I'll stick with this. The changes that we made to the language that we proposed language back on January 15th, I'm gonna use the fancy annotate function, which has become a new favorite of mine. Back on January 15th, we removed the language about implementation of the premium date.
Right.
That's already much in effect. This is not what I want. There we go. We updated the 2023. We updated the contract effective year, right? I'm going to highlight because we should probably change the $10 per month
Right, to 12.
to 12. Again, on 12.5, we changed the monthly.
Here,
Yes.
On 12.3, it should be 2021. Because the contract that you are negotiating is 21, 22, and 23 now.
Understood. Okay. That is an excellent point. And that should change the language on 12.5 as well.
Right.
Yeah.
So considering that we're doing calendar year now instead of kind of an academic benefit year, would it make sense to just say 2021 or 12.5?
For 12.5, if it's just a guarantee for 1 year, I would just say for calendar year 2021.
Okay, and it's just kind of it's my understanding of the language of Dr. Sumpfest is it's just to kind of set a bar for the escalation clause to kind of take over.
Right.
Yeah, exactly. So what that means is what we have tried to do, yours is a little bit different because your benefits are so different and you're on the 3-year contract. But the way we look at all of Gator Care is that an increase is applied across all the plans equally. So if we were to increase for 2022, that same increase would be applied to Gator Grad Care, but it wouldn't impact the employee-only piece of it. It would impact the spouse, the family level coverages. We haven't for the last, I don't remember how many years, changed that, but we were going to increase rates for 2021, but because of COVID, we backed off, changed the benefit that we were moving into, so every rate was kept equal.
Okay, gotcha. So I've reflected the changes you suggested, and because it's different than the language that I initially proposed, I've highlighted that as well, even though it's underlined.
Right.
The only other change I think was grammatical under 12.6. I stuck an "and" in there and capitalized out of area plan.
That's fine.
Maybe, okay. But so this is my copy. This isn't what I sent you guys. Okay.
That's
so my
fine.
copies. Oh yeah. So otherwise,
if you
these are the
change-
only language changes.
Right.
We're on board.
And-
Bobby, Rachel, thoughts?
Change the premium to 12.
Yes. So again, this is my copy.
That's fine. We can still TA it.
Okay. Any thoughts, Bobby and Rachel?
I'm good.
Okay. So I'll repeat, as a matter of posture, I think you have to send us this document, right? Because it is your proposal.
That doesn't matter. That does not matter.
Okay. So what I'll do is I will.
Yeah, just I think you just have to make the.
Change
add
that.
that a
the edit?
signature line.
Is that what?
Right. So I have made the edits. I'm retracting the highlighted and replacing it with underlines.
Yeah, I would change up in the header. I would change the date to today's date.
Okay. Also going to try to clear my drawings. Excellent. So I don't actually know what the current dependent rates are.
Yeah, you do if you look at that email I just sent you,
Okay.
because I've got it on there. Let me pull it up real quick that I just sent you. The current rate is employee plus spouse partner for this year was 206.86. The employee plus child was 188.42. And the employee plus family was 385.66. That's the employee portion of it, not the full amount.
Right.
Okay.
Dr. Sunfest, is that the new rate, the new proposed rate?
No, the proposed rate is different. That's what we had as, now, I don't know if that's what you were charging them, but that's what we had in our documents.
Yes, that's what we have as the old rates.
Yeah, those are the old rates. The new rates, if you give me, let me share again, I'll show it, I'll pull it up again.
Yeah, that's the 238.
So the new rate, which is 238.51 for the employee only, results in a $12 per month employee. The employee plus spouse, which is total, which is $495.90. The employee portion is $211.75. That would be the rates for 2021. The employee plus, employee plus children, the total is $472.31. The employee portion is $192.70. And the employee plus family with the total amount was $729.76. The employee portion will be $394.80.
Can you repeat the employee plus spouse contribution, Dr. Sunfest?
Sure. For which one? Are we talking about current or net or the new one?
So as I understand it, this should include the new one.
Okay, so the new one, so the new one would be $211.75.
Okay.
The child would be, yeah, you got it, and $394. Yes, that's what
Okay.
that is calculating the same percentage paid by UF as they are paying now.
Right.
So
So this reflects the 2020 number plus a 5% increase.
no, it's just it's a 2.4%. That's, you can't go more than 5%. This
Right.
is
Okay. So even better then.
Yep.
yeah, we're not
Okay.
gonna increase it more than the rest. That's
Okay. No, understood. I'm not going to question the business decision, and it benefits us, it seems. So, okay. So these are the rates that will take effect and be active through 2021. Come 2022, it can change up to 5% more.
Right.
Okay. All right. So I think the only thing I would need is a signature line for both of us. If someone knows how to actually do that, please let me know. Because I do not.
Javi, you also
Yes.
mentioned earlier you had something about UFFGAU will appoint one employee to serve on the committee. That was stricken. I don't know if that was meant to be stricken or not. I just noticed it wasn't in this one.
So are you? Oh, so it's here under 12.2.
Yeah, I thought in your earlier one it was stricken through, but I could be wrong. I just wasn't sure.
Yeah, I don't actively remember doing that, Rachel.
Okay, it could be my eyes or
Okay.
the pain pills I am on. So who knows?
And I don't think we talked about removing that
Yeah.
either, whether currently active or not.
Right. I'm comfortable.
Yeah,
Okay.
this is the current language.
Yeah.
Yeah. So I think if there was a strike through it, it might have been an error while we were workshopping it or something.
Yeah. And I don't anticipate that we will rebargain, but It's nice to have the protection in there just in case.
Agreed. So
Um,
I'm still struggling to find the signature line on here.
Oh,
For,
go-
for my members, sorry, Bill, just since this was broached, a rebid is if the university decided that we needed to have a different provider other than Gator Care for Blue.
I'm sorry, what?
I just told them what a rebid is.
Oh, no, I'm not talking about options. I'm just saying we have either Gator Care or something else. I don't anticipate that we're going to be executing a change from Gator Care to some other provider.
Yeah.
I think what we have is a very good program, and I would like to keep it. Yeah.
So I don't know if you'll see that signature line I've got. Is that sufficient, Bill? I figured we
Yeah.
could just write in the
Yeah,
date.
that's
Okay.
fine. That's fine.
So I will save this document, forward it to you guys one final time. I imagine we'll want to do this over e-sign, correct?
It's DocuSign, I think. but-
DocuSign, sorry, DocuSign.
Yeah.
And we can attach the Appendix F directly to it, so we don't have to sign two separate times. We just have one
Right.
all-consuming document.
Do we have a DocuSign account on our end?
I have one, and that's how I did the MOU.
Okay. Let me and Meredith know if you had to pay for that.
I did not. I think UF. I had to do training through UF to get that access, but I haven't paid a dime.
Okay,
So,
so you don't need any reimbursement?
It's very useful.
right, I'm forwarding that to you all now, and then we can talk about Brooke. We have your Article 20 proposal. I guess we'll have some follow-up comments on healthcare, very brief, and we can address Brooke and Paul's Article 20 proposal. And then with our time, I figured we could liberate Dr. Sumfest from bargaining jail, and we could talk about kind of where we stand on the other issues very briefly, since this is kind of a milestone point.
Sounds good. I will send you the language for the 0 member cost share, so you can see that. And do you want, I can change that to add the $20, or what I'll also do is send you a copy of the benefit slicks, because it has the annotation about the $20 copayment for the New Directions behavioral health providers. So you'll have that as part of the documentation. Okay.
Perfect.
All right.
Perfect.
Very good.
Thank you, Dr. Sumfest.
Have a great afternoon, or what's left of the day.
Yeah.
Bye-bye.
You too. Thank you so much.
Okay. Bye-bye.
And Victoria and Kay and Shannon, I think we're all set on this.
Okay, so we will get the website updated.
And the
With
portal
this
as
new-
well. Yes.
Yeah, and the portal as well. So for any GAs ready to go out there, we'll have that verbiage off and we'll be ready to roll.
Yeah, but you ought to include there saying pending ratification of a complete contract.
Yeah. We'll do that.
Okay, thank you.
Okay.
Thank you so
Have a
much.
good day,
Really
everybody.
appreciate your time.
Okay, and before we go on to that, if Becky can send the DocuSign thing to me, then I can sign that and we'll get that one taken care of.
Yeah, as
So-
soon as I get it all loaded for Bill and for Javier to sign.
Right.
Thank you, Becky. I just forwarded that document to you all. Let me know if you've received that.
I did.
Okay, thank you, Becky. I want to thank the university team for working with us on healthcare. This is a complicated beast with a lot of moving parts. It takes a little bit of education on our end, and we constantly have to update an alphabet soup, it seems. But I really sincerely appreciate the strategy to have Dr. Sumfest very much involved in these discussions. It has helped inform us. And I think it made it so that we didn't have to spend so much time playing catch up with this terminology and these numbers. We could very quickly glide into meaningful and fruitful discussion during these bargaining sessions. So I commend you for working with us on that front and making these resources readily available to us.
She did do a super job, and it is complicated. Not many, I don't know of any place else in the country with grad assistant unions that have their own homegrown healthcare program. And so when we first negotiated that change, it was very complicated. So, okay.
I believe that.
And it's actually a good thing that it's very complicated because one can make a career out of those complications.
You got it.
Yeah, I'm getting flashback headaches just thinking about last time. It was, oof.
Yep.
I foresee an increase in Bobby's talk space usage over after this. So I think this is a good time to move on to Article 20. I can share what you sent us, Brooke. I'm excited to. If y'all just give me 1 second, I will post that for everyone to see. Okay, I hope everyone can see Article 20, Proposition 4. I'm sorry, Proposal 4 from the university here. I'm not getting any.
I can see it, Javi.
Okay,
I can see
thanks,
it,
Brooke.
Javier. Yep.
Okay, I'm going to give you the floor, Brooke, in
Okay.
case you want to go over any changes or any specific points.
Certainly. Would you mind to switch out your review settings so we can see all the recommended changes in your proposal and then our counter proposal? I think
Sure.
if you change a simple markup, yeah, there you go.
Okay, yeah, that's a lot more colorful. Okay, let me know if you need me to move up and down the page, Brooke.
Perfect. So first of all, I do just want to acknowledge that I think we agree with your concerns and information that you provided to us as we've been talking through this proposal. I'm hopeful that as we discuss the details of our counter proposal, we'll be able to hear your concerns and reach a conclusion to this and give this TA. So we obviously understand that the primary purpose here is to have an avenue for people who are impacted by disruptive conduct to be able to have redress and resolution. We believe that the best title for this would be employee well-being here, as opposed to a mental health inquiry. And some of the edits do follow the previous discussions we've had along the idea that we do recognize the health and well-being, which includes mental health, employees could be severely impacted. And that phrase, willful efforts to damage the mental health of its employees, whether willful or not, could constitute misconduct. And so we felt like that particular phrase could come out of the counter proposal that we sent you. And we go to the second paragraph. The reporting process for filing a formal complaint does have a specific channel to UF Human Resources, as opposed to, and in defining that as opposed to an appropriate administrator, we think is important here, so that employees who may have concerns about speaking to their chair or to perhaps a PI who may be involved in some way, they know that there's a clear pathway to avoid those complications and go straight to UF Human Resources. And we thought it was important to acknowledge that the misconduct, regardless of whether the misconduct substantially or detrimentally affects their mental health, was important to reflect here. And then the key with anonymous reporting, we struggled with this a bit, and I just want to take a moment and explain why. If you could just scroll down so we can see the rest of this section here. So an anonymous complaint can sometimes be very helpful to the university, but often that may not contain enough sufficient information to investigate. Also, we are bound to provide due process with any investigation. And so in the course of providing that due process, there is a threshold that has to be met in terms of content of what is shared in an anonymous complaint. And so that can be a challenge there. So we wanted to qualify that statement. But we obviously receive anonymous complaints and take those very seriously as well. We go on to say here that we would investigate allegations of misconduct. And the key that I want to just explain here is that when we receive an allegation of misconduct, we consider whether that allegation, if true, if substantiated, would represent disruptive conduct. And we've indicated here that that could be an example here, incidents of verbal abuse, emotional abuse, or threats that would constitute misconduct. If on face value, we looked at a complaint on the front end, then we would investigate it if it met that standard. We did qualify again the requirements of due process and investigations. And then finally, the university, at the conclusion of the investigation, the reason we removed taking action to remedy the instigating incidents or condition is because the investigation process is a human resources function. The remedy of the findings of that investigation are in the hands of the dean or administrator who has hiring authority and oversight for that particular college or department. So that's why we made some adjustments there. So I'm happy to talk through if you have questions or concerns about this.
Okay, thank you, Brooke. I'm happy that you kind of guided us through your thinking in formulating a response. I like a lot of what you've included here, and I especially after you've explained some of it. So just for my understanding, for my sake, looks like this is creating a kind of a new animal than what current policy includes, in the sense that there's a good faith attempt at anonymity. The investigative findings are reported to GAU. What else from an HR perspective procedurally? And you talked about this a little bit with remedying, remedying a malfeasance, remedying a misconduct. From an HR perspective procedurally, is there something I'm missing that's new or different from current policy in this proposal as written, besides the anonymity, sharing findings with GAU and the complainant, and the limits on HR's ability to remedy the situation?
Obviously, we haven't had it outlined in the contract, but I think these premises that are outlined here in this proposal are consistent with how we deal with investigations of misconduct. So I don't think that we have created any new process that would have to be an infrastructure put behind that. This is an existing process that we want to articulate in the contract and have in place so that there's agreement about what's important and what we both value here.
I understand. And I think last time we spoke, I tried to sell this as an extension of, you know, the disruptive conduct policy is written. My other, I guess a question is, would you and your team be amenable to a permissive statement, not a requirement, not anything, you know, kind of determining the nature of an investigation, but a permissive statement allowing a graduate assistant to offer an impact statement about how the disruptive conduct may have affected their well-being, not just their mental health or the well-being of their working environment.
So if I'm understanding correctly, you want a statement that indicates that a grad assistant would be able to make a statement about their impact to their mental health, am I?
Yeah, yes. Permissive. The GA is not required to, and it isn't part of. It wouldn't be language that triggers the investigation, per se, right? But it gives them that opportunity, and you know, kind of. It's something that we think might help inform the process a little bit without creating any hard procedural requirements.
So oftentimes when we receive complaints, they contain that type of information. I guess we would be interested in what type of language you would propose here that would acknowledge that, or a permissive statement that would allow for that, because I'm not opposed to the idea. And quite often, as I said, when we receive a complaint, it does contain the impact to a person's either physical safety or emotional health. Not opposed to that idea. I just don't know what that looks like in the contract. But I think we could.
So I might be too close to this. So first, let me say that I very much like that this section is not as vague as it is in the current contract. So I do like that it spells out the process more. And I think people who would want to come forward and make a complaint would be comforted that all this is laid out. You don't have to define it like you do with the current contract language. So I really do appreciate it. And I've seen this problem a lot, where, you know, we want to, you know, we've kind of talked about triggering an investigation, but the language is kind of vague. We're not sure if it covers anything beyond OSHA type violations. So I'm kind of close to it. I'm having a hard time, to be honest, understanding sort of the difference between what you're proposing and what this says already, right? This first sentence in the last paragraph here, you know, the bargaining unit employee reporting the conditions, to me, includes what you're saying, like an impact statement. You know what I mean? So I don't know if it includes what you're saying, because.
Yeah, I understand, Bobby. That's well taken, and that's just me honestly spitballing. I'll volunteer that, you know, I haven't had time to sit down with my committee and talk over these changes, and we will have a lengthy discussion. I think you've given us a lot to really think about. This is just me kind of throwing ideas as an individual, as a chief bargainer, but not as someone who's had time to kind of dive into this with the committee. So your point is well taken, Bobby, and I think we're going to have a discussion about whether we you know, what language we want to modify here and to what extent. So that point is well taken. It sounds to me like currently, you know, the complaints, or I imagine the complaint, I've never formally submitted a complaint to HR. That being said, it sounds like the form allows for this kind of information. but I'm not sure that it requests it. Is that fair to say, Brooke? There's not a section that says, how has this affected you? Rather, sometimes people submit a complaint and, you know, as a matter of happenstance, they also, you know, grieve in this way. They say this makes it hard for me to work in this environment, et cetera, but the form doesn't specifically ask for that kind of information. Is that fair?
That's accurate.
Okay, okay. Gotcha. Okay, we definitely need to talk. I think that the takeaway for us is, you know, we feel very good about this language. It's given us a lot to think about. I don't know what else I might consider in terms of a change, apart from what I just thought of as that impact statement. But again, that's obviously, you know, even within our own ranks, that's something that we need to kind of flesh out as a team, as opposed to just an individual idea that I had. So thank you, Brooke. I think that this really reflects a good natured intent of the university to meet us on a substantive level. And I think we are very close to TAing this as well.
Great.
Any other thoughts on the Article 20 proposal? Okay.
Not from our side.
Okay, excellent. I figure we can just do a quick rundown then of what's kind of left on the table to address. I'll start with our side. I think there's one thing outstanding that we have not responded to apart from this Article 20 proposal, and that's your proposal for grievances, Paul, which we've had some discussion about, and I think we will TA that very soon as well. I don't think that are proposing any changes to the grievance language, and I think your language is reasonable. Apart from that, I think we're waiting on the university for a few things, and this is my list. Literally off my notepad. I haven't dug around through my emails, but I know related to our omnibus proposal, there's the paid leave article, and we sent some supplemental information to the university about that.
Right.
And we had I forget which article it was, but regarding the life of a GA contract, potentially allowing a department to extend that beyond a year. We also need to, at the university's request, amend Article 10 language regarding fee relief.
Right.
And I know, Brooke, I think you sent me some information about possibly why we can't have it in the current structure. I don't know if this sounds familiar to you.
I can certainly go back and check, but that's not ringing a bell. Sorry.
Okay. That's okay. Either way, admittedly, I was a little confused by it. So we'll probably have a discussion about why this needs to change. I understand that you may not have those answers. There's a legal question potentially here, right? But that's something on the chopping block,
right.
Not chopping block, on the table. Also, I think, Bill, you mentioned earlier in the year the need for a conflict of interest change to the contract.
Yeah. Yeah, we're still working on that
Okay.
with the faculty at this point. I think
Okay.
we're close, but
Okay. That's something that you'll probably resolve with the faculty and then just send us a mirrored version.
yeah, yeah.
Okay. Neil? Yes, Paul.
I think we also, what seemed like a long time ago, sent you some modest language changes for Article 4, subsection 9, the summer appointment stuff.
Oh, yes. So that's, let me pull that up, Paul.
And as I recall, that was a little bit like the grievance stuff. We kind of were in principle on the same page pretty quickly, but I don't think we ever actually did anything.
Okay. Yeah, I have to revisit that. I don't, but yes, I agree. I think that we worked hard together to carve out specific language there that we both agreed on. So I will follow up with that, because that's something we can probably get out of the way as well. Independent of that, we have to update the COVID MOU to reflect these healthcare changes that we've discussed. Also outstanding related to the COVID MOU is the language regarding cleaning done by GAs.
Okay.
So we can probably kill those two birds with one stone. The only other.
Javier, I'm sorry to interrupt. Could I just ask a question about that? I saw that language and wanted to just talk through that with you. Obviously, there are a number of cleaning measures that are recommended for workspaces, both standard cleaning, cleaning for cases where there's a suspected COVID positive person, and then there's a more of a deeper level, a third type of cleaning there. And so as we're thinking about the way your language is drafted there, I just wanted to understand better here. These types of cleaning activities that are listed here in the MOU, are these for just routine close of the day type cleaning that it's referring to, or are these something different here? And I guess I'm trying to put it in perspective of how would this particular type of cleaning be handled prior to COVID? In other words, who did this, and are you suggesting that the GAU is saying that those activities would no longer be performed? We're just trying to get an understanding of that. Obviously, with the fact that surfaces and COVID, and we're not pre-COVID anymore, but help us understand where that's coming from.
These are cleaning tasks that were not asked to be performed pre-COVID, and are now being asked to be performed by GAs, specifically cleaning up after undergraduates. So cleaning. So let's say there's so I'm using the term lab here, as in like you have a lab for a chemistry class, right? Or a lab for a biology class. So you're a TA, you're teaching the lab section, and you ask the undergrads to clean up after themselves, and they do. But you're asked to also go back and clean up after each and every one of them after the conclusion of that section for that day. So you're asked to deep clean desks and lab space after undergrads leave the room. You're on mute. I think I can sort of see you talking.
Yeah, thanks. Sorry about that. Yeah, that's helpful in just trying to understand. So this is cleaning because of COVID, but not because there's a concern someone has COVID in the work area, but just beyond what would normally have been done previously.
Correct, yeah.
Has this been occurring or reported to you, or is this more of a
it's been reported. It's been a policy in at least one department.
Then if you could give us that data, we can go to work on that.
And I think the reason I'm asking these questions, so if I take a case in point here in HR, we have maybe 30%, 40% of our staff here on a daily basis. Maybe it's higher than that. But if we have an event where we gather in a conference room with physical distancing and we're all wearing our masks, we typically then clean those surfaces where we've sat. One or two people may go into a room to do that. I've done that. Others have done that. And it is definitely not what we did 8 months ago as a normal process, but it's a routine that we've taken on just for the well-being of the workspace. obviously, are you more concerned about this from the standpoint of transmission of COVID, or a work assignment that is above and beyond what GAs have been asked to do in the past?
I would say both. I mean, for everyone, so anybody who is asked to do this, I'm concerned about their new additional work assignment and their increased workload. I'm concerned about that for each and every graduate assistant who's asked to perform these duties. I'm also concerned about COVID transmission when it comes to those graduate assistants who might have pre-existing conditions or who are at increased risk for complications from COVID, if that makes sense, right? There's a concern that covers everybody, and then there's a concern, an additional concern that I have for our vulnerable populations. And I mean, we are talking about, you know, and we're not just talking about like, you know, dusting tables or, you know, spraying them with Windex. We're talking about like a full workup, right? Janitorial type work.
So are you talking about something beyond just getting Clorox wipes and wiping a surface? I mean, is this?
Yes, because the undergraduates are asked to do that, right? The undergraduates are asked to do a quick, like, you know, wipe that down when you leave with the Clorox wipe or whatever's provided to them. And then the GA is asked to go and work up like the seat, desk area, everything. I mean, we're not asking for anything that's beyond what's in the faculty MOU.
Okay, thank you for talking through that. Something that we can talk about with our bargaining team. Thanks for explaining that.
Yep, no problem.
Yeah, thank you, Bobby. Bobby's a lot closer to this topic than I am. So thanks for shedding some light on that. The only other, I guess, thing we would probably want to scour the contract for is sort of these date provisions. I don't think that would take very long, you know, but probably it's worth going through the contract one more time to see what date changes we need to make.
Okay.
That's all I've kind of got on my radars. It's quite a bit. But moving forward, I think we can, we're close, if not done, with an Article 20 TA and the grievance language, and I'll check into the summer appointment language that has been kind of off my mind for some time, but I think we're almost there on as well.
Okay. I need to sign off, so I will await the DocuSign thing from Becky, and I'll sign it sometime this afternoon if I have a chance.
Okay, no worries, Bill. I don't think that our team has anything else for the university.
Okay, thanks.
All right, absolutely. Have a great afternoon.
Yep.
All right, everyone.
Everyone, have a great afternoon.
Likewise, thank you for your time, and we'll see you soon. For those of you in GAU, we're going to have a caucus now. If you check your webmail, you should have gotten a link for that. We can kind of hash out what happened today and what we can expect moving forward. If you've been following for some time, it shouldn't really take a lot of your time today, but we can happily answer any questions or address any concerns you may have had from today's session. Thank you, and we'll see you shortly. If not, we'll see you soon. Thank you.